Hello, everyone, and welcome to today's COVID-19 Community Conversation. Before we get started, I'd like to go over a few items so you know how to participate in today's event. If you're listening in on your computer's speaker system and would prefer to join over the phone, just select telephone in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. And now it's my pleasure to introduce our presenters. First, UMS President and CEO, Dr. Mohan Santha. Second, UMS Incident Commander, Dr. David Marcosi. Today, Dr. Santha and Marcosi will be addressing several topics of importance to our communities, and they include, first, caring for our patients, second, caring for our community, and third, caring for each other. And so at this point, it's my pleasure to introduce Dr. Santha, who's going to start off by talking about caring for our patients.
So I appreciate the introduction, Chris. And on behalf of the entire medical system, I want to say to everyone who is listening, thank you for taking your time. And thank you for the effort to stay informed and to be educated about where we are in this response. As Chris mentioned, we are this afternoon trying to accomplish communicating about how we're caring for our patients, our community, and for each other. And there's probably no better place to start than talking about the holidays that those of us whose faith traditions recognize this time of year as an important time. We understand that this presents particular challenge to the traditions of how we recognize and celebrate these holidays. I and our leaders have spoken to many faith leaders across all of the communities that we're blessed to serve, and we've asked there to be a consistent message that is delivered and that we are imploring our members of our community to stay home and to celebrate the holidays this year differently than we've done in the past. And I understand that this is an incredibly significant request that we are making, and that it does, in fact, place hardships on many. But I would also tell you that we've been inspired by the innovations that people have used to ensure that as families they are still celebrating and recognizing the traditions of their faith, and at the same time practicing the social distancing parameters that have been put in place to keep all of our communities safe. And so whether it is connecting via technology with family or actually watching and participating in religious services online instead of in person, we want to, again, reemphasize how important this is at this very particular point in where we are in dealing with the healthcare challenge. So I want to now move to the next slide where we talk about where are we in terms of the update regarding the status of COVID-19. And so let's start within the United States, where there are 466,396 patients who have been diagnosed across the U.S. with COVID-19. In the state of Maryland, we have 6,968 patients who've been diagnosed with COVID-19. And here within the medical system today, we are actively managing 44 patients who are described as persons under investigation, which we believe they may have virus activity, and they're being tested. And then we have another 171 patients across our 13-member organizations who are being cared for with a proven diagnosis of COVID-19. So when you look at the state, what we recognize is that this virus has spread across communities around the state. And you've heard this conversation that is a national conversation, and we in the state of Maryland recognize that our reality, based on the data that the governor and the state have released, that there are members of our community that are disproportionately affected. The African American community has been disproportionately affected, and we are seeing that consistent with the way the data is being reported from the state. And we'll get into some information about that later on. But you should know that the White House has designated the Baltimore-Washington corridor as an emerging hotspot nationally. And that means this region demands urgent federal attention in terms of access to resources in order to be prepared and to address the increase in patients who are coming to us. And there are specifically 12 jurisdictions that are highlighted on the screen, from Baltimore City to Baltimore County, to Carroll County, Prince George's County, Montgomery County, Anne Arundel County, Howard County, Frederick County, Hartford County, Queen Anne's County, Calvert County, and Charles County. All 12 of these counties have been recognized as having an incidence of this disease that is higher than other areas of the state and of the nation. So we have been planning for this inevitability for now nearly 2 months. We've launched an expansion of our health care services and our telehealth services that allows our patients and our communities to interact with healthcare providers directly from home. We've done this also at the same time that we've decreased purposefully elective care procedures. We've delayed them where clinically appropriate to allow us to be able to deal with the critically ill patients within our health system. You may have seen the coverage of a joint effort that we've done in partnership with Johns Hopkins Health System to establish a field hospital at the Federal Medical Station that is now the Baltimore Convention Center. So this is a partnership with the state, with federal government in terms of some resources, and with Hopkins in Maryland in order to recognize that we have to stand up alternate care sites in preparation for what we expect to be the inevitable surge of patients. We are fortunate within our health system and within the University of Maryland, Baltimore, that we have thought leaders that are helping shape the state's response to this crisis. Dr. Marcosi, who's on this webinar with me, is one of 2 University of Maryland, Baltimore School of Medicine faculty members who are part of the 7-person task force that has helped the state shape their response. And Dr. Marcosi himself was part of the governor's coronavirus response team that actually helped tour the governor through the federal medical facilities. And we are trying to emphasize to everyone how the medical system is leaning into this challenge and actually is demonstrating unique partnerships with other nonprofit health systems as well as with state and city agencies in order to prepare us best to serve the needs of our communities.
Thank you, Dr. Santa. We're now going to move on to our second topic, which is caring for our community. And it's my pleasure to introduce Incident Commander, Dr. David Marcosi.
Thanks, Chris. Dr. Santa, happy Friday, everyone. And I know that we're all having my best wishes to all of us during this holiday season, this holiday weekend. Just an emphasis from your Incident Commander for the University of Maryland Medical System. Let's stay physically distant from each other so that this virus doesn't get transmitted, but socially connected. So let's make sure that we all understand this virus and what it looks like. Most of the folks who are going to be infected by COVID-19 are going to experience mild symptoms. And those mild symptoms could be anywhere from some fever, cough, some mild shortness of breath, a little bit of sore throat. And that's probably about 80% of us will have some mild symptoms like that. We may actually have even less symptoms and may recover and feel well. The problem with it is actually you have the ability to transmit that virus if you're mildly symptomatic or asymptomatic, and that's what the concern is. So a couple things to know about it if you're having some of those mild symptoms or you're just kind of feeling a little bit of fatigued or maybe a little bit of muscle aches or you've got a little bit of that cough, you need to stay home. Don't go to work. Take a few days off, see how your symptoms improve, and you don't necessarily need to come to the hospital either. Don't go to the emergency department unless it's a true emergency. You're acutely short of breath, chest pain, fever that's not controlled by Tylenol. Any of those things are potential reasons to either call your physician to talk to him or her about how you're feeling and or go to the emergency department if you're really feeling like you have a true emergency. You know what, also, there's a nurse triage line that we've stood up, which is 24/7. So 7 days a week, 24 hours a day, you can call our nurse triage line, which I'll speak to in a second. Actually, they just flipped the switch, so let me just talk to you about what that number is. That number is, for our nurse triage line, is 888-713-0711. And I'll say it again, 888-713-0711 for those folks who are just dialing in and can't actually see the slides. You can also go, if you've got internet access, to go to the CDC website, and there's a COVID-19 self-checker tool, which is pretty nifty. And you can go to their website and you can evaluate your symptoms, and how it will help you manage your health. And lastly, we actually have a website as part of our unified command system, and it's ums.org/COVID. So that's UMMS.org/COVID, COVID. Next slide. So we need to stop the transmission of this disease. It's done by the simple things that we all know, but it's time to do them and encourage them even more amongst our family members, our children, and ourselves. Encouraging maintenance of best practices such around physical distancing, proper hand hygiene, consistent cleaning and disinfecting of areas that are high touch, like doorknobs or phones or light switches or countertops. Those are all going to be important to help protect you and your family against COVID-19. When you're washing your hands, this isn't a simple wash your hands with a little bit of soap and you're done. Washing your hands with soap and water for 20 seconds is, as my 5-year-old says now, sing the alphabet, Dad. So sing the alphabet, and that's usually about 20 seconds, and if you wash your hands for that full amount of time, you'll be in good shape. If you don't have soap and water, which most of us have, you can also use hand sanitizer. Next slide. So we're all talking about this idea of social distancing. It's really physical distancing. What you want to do is not allow the virus to be transmitted from yourself to others, and particularly those who are most susceptible to those diseases. So those of you who are listening who have maybe COPD or high blood pressure or congestive heart failure or heart disease, you all need to be very careful to make sure that you don't contract this virus, and so you need to make sure that you stay away from folks and practice physical distancing. Stay socially connected, but practice physical distancing, particularly for those who are younger, because those who are younger actually demonstrate mild symptoms. So they may not even feel badly, but they may be transmitting the virus. Physical distancing means keeping approximately 6 feet between you and another person, even potentially wearing a mask outside, as you saw the mayor did during his recent press conference. Those are all reasonable things you can do to think about to lower your risk. Next slide. All of us need to practice those things, those simple things like covering your mouth when you sneeze or sneezing into a tissue, and after you use a tissue, throwing it away, and washing your hands. And here's one of those things I'm always concerned about, is that after you sneeze or you touch a doorknob, then you touch your mouth or your eyes or your nose, and then you obviously have the chance of getting infected from this virus. So you want to decrease your touch to high-touch areas as much as you can, and also keep them very clean, just as we talked about before. Next slide. I mentioned quickly about masks, but let me talk to them a little bit more. So the CDC is now recommending that everyone wear a mask, a homemade mask, when they're in public during this pandemic. UMS actually adopted this stance as well. So every time you're in an UMS hospital, you actually walk through the doors, you need to be wearing a mask. We have a no visitor policy. We do have some exceptions to that policy, but we need you, if you're a patient, to be wearing a mask when you come through the doors of our facility. You can also make a cloth mask at home with a bandana or an old T-shirt, and we actually have links to this on the umms.org/COVID website. What's important, though, wearing a mask decreases your transmission of this virus, but it does not replace physical distancing and social distancing. So if you do both, you're in better shape. Next slide. I talked a little bit about cleaning surfaces that are high touch. Let's just make sure we're doing that, the microwave, the phone, the doorknob, the light switch, handrails when you walk up and down stairs. If you do touch those, then make sure you wash your hands after that. Desks, countertops, all of those, the more we can keep those areas clean, the less this virus will be transmitted. Next slide. I've got a lot of interesting questions around grocery shopping. So you can actually think about, and if it's an option, doing your grocery shopping online or using curbside pickup. So when you can order your groceries, you don't need to necessarily go into a grocery store. If you do need to go into a grocery store, there are some stores that are having senior hours. So take advantage of those if you're older, and use those senior hours to decrease potentially high traffic areas or times when a lot of people are in grocery stores picking up what they need, because that means you have the potential to get exposed to this virus. Lastly, when you walk in to a grocery store, make sure you wipe down your shopping cart with disinfectant wipes, or don't touch or pick up items that you aren't going to buy. This isn't time to browse. Go in, buy what you need, and get out. So that way you decrease your transmission of the potential chance of having this virus transmitted. Don't touch your face, your eyes, your nose, your mouth after you touched items in the store. Make sure you wash your hands or use hand sanitizer. Next slide. When you bring your bags home, bring one bag in at a time. Sanitize the items, because you know what? This virus stays alive on cardboard, on paper, on plastic for a couple days. So you need to make sure that you wipe down things before you put them away, because there's a chance that the virus could be on those, and you don't want to have those transmitted. After you take those things home, wash your hands to make sure that the virus is not on your hands anymore, and you don't have to worry about transmitting that to yourself. Next slide. So we talk about our physical health. Let's also talk a little bit about our mental health. We all need to make sure we stay connected. We can't stay physically connected because there's a chance that this virus may be transmitted between us. But you know what? We can stay socially connected. And staying informed, being able to reach out through the phone, through FaceTime or Zoom or any applications that allow you to stay connected, now's the time. Because not only do we need to maintain our physical health, but we need to maintain our mental health. Now's the time. Let's continue to prepare. Now's not the time to panic. We look like we may have, as Dr. Santa mentioned, some increasing numbers in case counts over the next week or two. That's to be expected. We may have increased testing capacity, which means we may have more positive tests. But let's make sure we stay connected and stay informed so we don't have any panic and we know how to manage this disease moving forward. Next slide. There are some resources that we have as part of this slide deck, and I'll slowly walk you through them in case you've only dialed into this call. There's a disaster distress helpline, and that phone number is 1-800 985-5990, or there's a crisis text line, and you can text TALK to 741-741. That number again, 741-741. Or lastly, in Baltimore City and across Maryland, there's the 211 system. So you dial 211 on your phone or 211md.org if you go to a website, and it can connect you with other community sources. I'll turn it back to Chris for a follow-on.
Thank you, Dr. Marcozzi. Now I'm going to introduce our third and final topic, caring for each other, and handing it back to Dr. Santa.
So I think I am going to reinforce the messages that Dr. Marcozzi just delivered, which is during this incredibly, and I'll use the word unprecedented time in our state and in our nation and indeed the world, it is easy to get discouraged and it is easy to feel somewhat overwhelmed. But I would also want everyone on this call to recognize that we are also seeing unbelievable acts of kindness across our state and within our communities. And the number of folks who have reached out to me personally, asking how they can help medical system staff and patients who we're caring for, has been at times overwhelming. We've been inundated with requests from people across our communities wanting to know how they can support the providers who are on the front line of this crisis. And the answer actually is quite simple, and Dr. Marcozzi said it, and that is the single most important thing that any of us can do who are able to do it is to stay home. The best way that we can all prevent the spread of COVID-19 and to, quote, flatten the curve that you've heard described on television every night is by staying home, and by staying home when we flatten the curve, what we are doing is alleviating the burden of the surge of patients that put the stress points on our healthcare staff. So many have also asked how you can help create these cloth masks that we are using in our organization as patients and visitors come and go through the halls of our organization. And what I'd say is we actually have posted on our website at umms.org/mask how to construct and sew cloth masks. And we put it on here because of the overwhelming demand for that information. You can package the masks that you create in plastic bags and drop them off to the registration desk at each hospital, where they will be inspected and distributed to staff as they are needed. And I want to make sure that I say thank you to everybody who has already donated masks and demonstrated incredible generosity.
Thank you, Dr. Santa. We are now going to answer a few of your questions that you submitted last week. First one is for Dr. Santa. If I'm seriously injured, can I still go to the emergency room?
Absolutely, the answer is yes. We as a health system are here to serve the healthcare needs of our communities. And while there is a disproportionate amount of attention appropriately focused on the healthcare crisis associated with COVID-19, we as the University of Maryland Medical System stand ready to address the urgent healthcare needs of our community 24 hours a day, 7 days a week, 365 days a year. That is what defines the culture of our organization, and we're not alone in that. Health systems around the state and around the country stand ready to do the same thing.
Thank you. Next question, also for Dr. Santa. Is it okay to go visit people who are asymptomatic? That is, they don't have any COVID-19 symptoms like the cough or flu?
So I get asked this a lot by family and friends who are hoping that my answer would be yes. But so that there is clarity, the answer is no. And I'll explain why that is. We know from international and now national data that anywhere from 25 to up to 33% of people who are found to be positive with COVID-19 from the testing that is done actually don't have any symptoms. So at this point in time, we can't tell you the time spent with family and friends just because they are asymptomatic means that you are not exposing you and your loved ones to risk. And that's the foundational challenge that we put forward to everybody when we ask everyone to maintain the practice of social distancing.
Thank you. Next question is for Dr. Marcozzi. How long does the virus live on different surfaces?
Thanks, Chris. I mean, this is a good question. I mean, this was actually studied in the New England Journal back in March of 2020. So this year, or pardon me, last month, this year, what the study found was that the virus can live up to surfaces from hours to days. On cardboard, it lasts about 24 hours, and on plastics, it can actually be 2 to 3 days. Plastic, stainless steel. And that's why you heard me talk about after you touch your groceries or touch something, and make sure you wash your hands afterwards and clean those areas up. Plastics, wipe them down before you put them anywhere, because there's a chance you might have live virus on those either cardboard or plastic items.
Thank you. Next question also for Dr. Marcozzi. I've heard that our cell phones are really dirty. Can I get COVID-19 from touching my phone?
Yes, our cell phones are dirty. Absolutely, Chris. We need to keep them clean. I think like iPhone or a couple of phones recommended using isopropyl alcohol, but the truth is you could just use Clorox disinfectant wipes, wipe the external, spray a disinfectant cleaner on a paper towel and wipe your phone down that's got any external surface on any of the external surfaces of that phone, both the front and the back, to make sure it gets clean too. There's actually some practical cleaning tips we have on our website of ums.org/COVID. But yes, absolutely, wipe your phones down.
Thank you, Dr. Marcozzi. We have time for one last question, which will be for Dr. Santa. The question is, why was my doctor's appointment rescheduled?
So now, many weeks back, we, the University of Maryland Medical System, in partnership with the other academic health system in the state of Maryland, Johns Hopkins, made the joint decision to reschedule routine appointments and elective surgeries in patients in which we believed it was clinically appropriate to do so. And we've done so until further notice to reduce the community spread and to protect our healthcare workforce within the medical system hospitals. We've also done so to ensure that we have the capacity to treat patients who are infected with COVID-19. So we greatly appreciate your patience as we work to protect your health as well as the safety and health and well-being of our staff. We strongly urge you to continue to stay in contact with your medical provider, as telehealth capabilities have significantly increased, and they may be an appropriate option for you.
Thank you very much to both Dr. Santa and Marcozzi for today's community webinar, and thanks to all of you for joining us. We hope that you will stay connected. You can find our social media channels displayed on the screen, and we hope that you will sign up for health and wellness emails at ums.org/email. We also want to remind you on ums.org, you can also get all of the latest information about what we're doing to protect you at UMS COVID-19 response, on the UMS COVID-19 response website at ums.org/COVID. Also wanted to do a quick reminder for the nurse call line, open to any person in the community. The number is 1-888-713-0711. Finally, we are grateful for everything you are doing to keep yourself, your loved ones, and our community safe. Thanks again, and have a great weekend.